Fibroid surgery, how to reduce adhesion formation. Imagine going through fibroid removal surgery and hoping for the best recovery possible. One challenge surgeons aim to prevent is the formation of adhesions, which are bands of scar tissue that can stick organs together. These adhesions can make future fertility more complicated and sometimes cause ongoing pelvic pain. So, how do surgeons work to keep these adhesions at bay? Let's explore the key strategies that are backed by scientific research and widely used in medical practice. First, choosing a minimally invasive approach, like laparoscopic myomectomy, is often preferred. This technique involves small incisions, which means less tissue trauma and a lower chance of adhesions forming. It also means less pain and quicker recovery for the patient. While it doesn't completely eliminate the risk, it significantly reduces it compared to open surgery. The less tissue damage, the fewer opportunities for scar tissue to develop. Next, surgeons focus on handling tissues very gently. They use fine instruments and precise techniques to avoid unnecessary injury. Controlling bleeding carefully is vital because blood can promote adhesion formation if it pools inside the abdomen. During surgery, irrigating the area with fluids keeps tissues moist and prevents them from drying out, which can also lead to adhesions. Using fine, non-reactive sutures and limiting the use of cautery helps prevent tissue ischemia, or lack of blood flow, which can worsen scarring. Keeping the surgical field clean is another crucial step. Avoiding contamination with bacteria or foreign materials like glove powder or lint reduces inflammation, which can increase adhesion risk. Maintaining strict sterile techniques and a clean environment are essential parts of this process. In addition, surgeons may apply special adhesion barriers during surgery. These are materials approved by the Food and Drug Administration that act like a temporary shield between tissues. Common options include gels or sheets made from substances like hyaluronic acid or oxidized regenerated cellulose. These barriers stay in place during healing and then gradually dissolve, helping tissues slide past each other instead of sticking together. Finally, optimizing the surgical environment itself can make a difference. Using warmed and humidified carbon dioxide gas to inflate the abdomen during laparoscopy helps prevent tissue drying. Keeping the operation as short as possible and using the right pressure levels during insufflation also reduces the chance of adhesion formation. In the context of fertility and conditions like endometriosis, preventing adhesions is especially important. Adhesions can block or distort the fallopian tubes, making conception more difficult, and they can worsen pain symptoms. By combining careful surgical techniques with adhesion prevention strategies, surgeons aim to improve fertility outcomes and reduce long-term complications. If you are considering fibroid removal surgery, it's important to discuss with your surgeon what methods they plan to use to prevent adhesions. Every patient's situation is unique, and personalized care is key to achieving the best possible results. Remember, always seek advice from qualified healthcare professionals to understand the options best suited for your individual needs.